Imagine waking up every single day with a burning sensation in your feet, or feeling electric shocks running through your legs for no reason. This is the reality for millions of people living with nerve pain. It's not just uncomfortable, it's life-changing. But what if I told you there's a new breakthrough treatment that's giving hope to people who've tried everything else? A medication that works faster, causes fewer side effects, and might be more effective than anything we've had before. In this video, I'm going to tell you everything you need to know about Mirogabalin, the new game changer in nerve pain relief. Stay with me until the end, because this information could change your life or the life of someone you love. Before we talk about the solution, let's understand the problem. Nerve pain or neuropathic pain is completely different from regular pain. When you cut your finger or break a bone, that's normal pain. Your body is warning you about damage. But nerve pain is different. It happens when the nerves themselves are damaged or not working properly. Your nervous system is basically sending false alarm signals to your brain. And these signals don't stop. The most common causes include diabetes, which damages nerves over time. Shingles can leave people with lasting nerve pain even after the rash is gone. Spinal cord injuries, chemotherapy, and even vitamin deficiencies can trigger it. What makes nerve pain so devastating is how it affects daily life. Simple things like walking, sleeping, or even wearing socks become torture. People describe it as burning, stabbing, shooting, or like electricity running through their body. Here's the biggest challenge. Traditional painkillers like ibuprofen or even strong opioids don't work well for nerve pain. That's because nerve pain isn't caused by inflammation or tissue damage. It's caused by faulty nerve signals. This is why doctors need specialized medications to treat it. And for years, we've been using the same old drugs with limited success and frustrating side effects. Until now. So what exactly is Mirogabalin? It's a next-generation medication specifically designed to treat nerve pain. Japan approved it back in 2019 under the brand name Lyrica. And in 2024, China also approved it, making it accessible to millions more patients. Currently, it's being used in several Asian countries with impressive results. So what makes it different from older nerve pain drugs? Mirogabalin is what scientists call a selective calcium channel blocker. The older drugs like Pregabalin and gabapentin work too, but they're less precise. Think of it like this. Old drugs are like using a hammer when you need a scalpel. Mirogabalin is that scalpel. It targets pain signals more accurately while causing fewer unwanted effects throughout your body. Let me explain the science in simple terms. Your nerves send signals using calcium channels. Think of these as tiny gates that open and close. When these gates malfunction in damaged nerves, they send too many pain signals. Mirogabalin works by binding to specific proteins on these gates called alpha-2 delta subunits. There are two types, alpha-2 delta 1 and alpha-2 delta 2. Mirogabalin targets both of them selectively. Here's the key advantage. Once Mirogabalin attaches to these targets, it stays there longer than older drugs. Scientists call this slow dissociation. It means longer-lasting pain relief with fewer doses. And here's something remarkable. Mirogabalin starts working in less than 1 hour. Most nerve pain medications take days or even weeks to show results. This fast action means patients get relief when they need it most. Let's talk about Pregabalin, sold as Lyrica. For years, it's been the gold standard for nerve pain treatment. Doctors prescribe it millions of times every year. But how does Mirogabalin compare? Studies show Mirogabalin provides similar or even better pain relief. But there's where it really shines. Side effects. Pregabalin commonly causes dizziness, drowsiness, and weight gain. Many patients stop taking it because they can't function normally. Mirogabalin causes significantly fewer side effects, especially drowsiness and dizziness. In clinical trials, patients on Mirogabalin were less likely to quit treatment due to side effects. One study found that Mirogabalin at 15 milligrams twice daily worked as well as Pregabalin at 300 milligrams twice daily, but with much better tolerability. That's a game changer for people who need long-term treatment. So who can actually benefit from Mirogabalin? The primary candidates are people with diabetic nerve pain, also called diabetic peripheral neuropathy. This affects millions of diabetics worldwide. Next, people suffering from post-herpetic neuralgia. That's the nerve pain that lingers after shingles. It can last for months or even years. Mirogabalin has shown excellent results for these patients. People with spinal cord injuries who experience chronic nerve pain are also good candidates. Chemotherapy patients dealing with nerve damage from treatment can potentially benefit too. Clinical trials have shown success rates of 50 to 60% in pain reduction. That means more than half of patients experience significant relief. Studies also show improvements in sleep quality and overall quality of life. These aren't just numbers. These are real people getting their lives back. Let's talk about how Mirogabalin is actually used. Doctors typically start patients on a low dose, usually 5 milligrams taken twice daily. That's once in the morning and once in the evening. If needed, the dose can be increased gradually. The maximum recommended dose is 15 milligrams twice daily. It's important to take it at the same times each day for consistent relief. You can take it with or without food. Most patients start noticing improvement within the first week, but full benefits usually appear after 2 to 4 weeks of consistent use. This is much faster than many older nerve pain medications. Treatment duration varies by individual. Some people need it for months. Others may require long-term treatment. The good news is that studies show it remains effective and safe even after a year of continuous use. Every medication has side effects, and Mirogabalin is no exception. But the side effects are generally mild. The most common ones include slight dizziness, mild drowsiness, and occasional headaches. Some patients report a bit of weight gain, though less than with Pregabalin. Compare this to Pregabalin. Pregabalin causes significant drowsiness in many patients. Some people feel foggy or confused. Mirogabalin causes these effects much less frequently. Who should avoid it? People with severe kidney problems need dose adjustments or may not be suitable candidates. Pregnant women should avoid it unless absolutely necessary. Always tell your doctor about all medications you're taking. Long-term safety has been studied for up to 52 weeks. The results are encouraging. No serious safety concerns emerged. The medication maintains its effectiveness without increasing side effects over time. This makes it suitable for chronic, long-term use. Let's look at real data from clinical studies. In 2024, Chinese researchers published comprehensive results. Patients reported an average pain reduction of 30 to 50%. That's measured on standardized pain scales. Patient satisfaction rates were notably high. Over 60% of patients reported being satisfied or very satisfied with their treatment. Here's something often overlooked. Sleep quality. Nerve pain disrupts sleep terribly. Studies showed significant improvements in sleep duration and quality. Patients were falling asleep faster and staying asleep longer. Quality of life measurements also improved dramatically. People could walk more, work better, and enjoy activities they'd given up. In head-to-head trials against Pregabalin, Mirogabalin matched or exceeded its effectiveness, but with a much better side effect profile. These aren't just statistics. They represent thousands of people regaining control of their lives. Now let's be realistic about limitations. Mirogabalin is not yet approved by the FDA in the United States. American patients don't have access to it yet, though research is ongoing. Cost can be a consideration. In countries where it's available, it may be more expensive than generic Pregabalin. Insurance coverage varies by region and provider. Availability is currently limited to certain Asian markets. If you're in Europe or the Americas, you'll need to wait for regulatory approval. Mirogabalin isn't suitable for everyone. It won't work for all types of pain. and individual responses vary. Some people respond amazingly well. Others see minimal benefit. This is true for all nerve pain medications. The most important point? Never start or stop any medication without consulting your doctor. Self-medication is dangerous. Your doctor needs to evaluate your specific condition, other medications, and overall health before prescribing anything. So, what does Mirogabalin mean for the future? It represents a significant step forward in precision medicine. We're moving from blunt instruments to targeted therapies. Researchers are currently exploring additional applications. Could it work for fibromyalgia, anxiety disorders, other chronic pain conditions? Studies are underway. The success of Mirogabalin is encouraging pharmaceutical companies to develop even more selective medications. We might see third- and fourth-generation drugs with even better profiles. The bigger picture is exciting. For decades, nerve pain treatment has been frustrating and limited. Now we're seeing real innovation. Better drugs mean better lives for millions of people. The future of pain management is becoming more personalized, more effective, and less burdensome. Mirogabalin is just the beginning of this revolution. Let's recap what we've covered. Mirogabalin is a breakthrough medication for nerve pain. It works faster than older drugs, often in less than an hour. It's more selective, targeting pain signals precisely. It causes fewer side effects, especially drowsiness and dizziness. Clinical studies show 30 to 50% pain reduction in most patients. It's approved in Japan and China with expanding availability. If you or someone you love suffers from nerve pain, talk to your doctor about whether Mirogabalin might be right for you. Remember, this video is for educational purposes only. It's not medical advice. Always consult qualified healthcare professionals before making treatment decisions. There is real hope for people suffering from nerve pain. Science is advancing. Better treatments are coming. You don't have to suffer in silence. If you found this video helpful, please hit the like button. Subscribe for more health and medical content. Drop a comment below if you have questions or experiences to share. Thank you for watching, and I hope this information helps you or someone you care about find relief.